Anambra State was one of the first states to take the grave threat posed by COVID-19 very seriously. It is a known fact that a large number of traders from the numerous markets in Anambra State transact huge volumes of business with their Chinese counterparts. Consequently, there is a great deal of traffic between Anambra and most commercial cities in China. But Governor Obiano'S showed acute sensitivity when coronavirus broke out in China late last year. In the third week of January this year, he directed the Ministry of Information to roll out a special campaign targeted at traders, advising them against traveling to China.
As early as January 27th, the governor called me and directed the Ministry of Information to issue an advisory to our people who were going mostly to China for business to stop going to China. And indeed, by this time, the viral outbreak had been reported in 13 European countries, and these are places that people frequent to in large numbers. We have also gone to all the major hotels and engaged major stakeholders on these issues. We took proactive measures early enough.
Subsequently, Obiano directed the members of the Anambra State Executive Council to take COVID-19 awareness campaign to the 63 markets in the state, where traders were sensitized on the threatening pandemic and what they must do to avert the looming danger. All these were pragmatic steps taken in the state at a time when the pandemic was still a distant, improbable fear.
The first stage is a stage of mitigation. You want to make sure the virus doesn't get to you. Then you get to the level of preparedness. Then you get to response. Then you get to recovery. Now, with respect to mitigation, the state, as early as January 29th, started sensitization. We went at the government level, State Ministry of Health, coming down all the way to the local government level, down to the world level. We started warning our people that there is something going on around the world. We spoke about the virus, whatever opportunity we had, in marketplaces, in churches. We asked people to get ready. We started talking about those mitigation measures, hand washing, wearing face masks, social distancing, non-contact salutation. All those things were part of that mitigation. The government of Governor Obiano did very well with that.
In response to the growing threat of the coronavirus pandemic, Governor Obiano inaugurated an action committee on COVID-19 headed by himself to ensure hands-on attention to the best ways of containing the plague and put in place measures to keep Anambra safe.
The idea behind the COVID-19 State Committee was for us to brainstorm and see how we can first prevent the virus from getting into Anambra State, and if for any reason it gets into Anambra State, how are we going to combat it so that it doesn't spread. And swiftly we move into action. His Excellency, through the committee, constituted 3 subcommittees, being the Public Enlightenment Committee, the second one being the Training Committee. The Training Committee, headed by the Honorable Commissioner for Health, immediately went into training all the health professionals, while the Public Enlightenment Committee moved into enlightening our people at the various communities and get them prepared of what the devastating effect is going to be. What a devastating effect is going to change our mindset, it's going to change our culture, it's going to change our tradition. Anambra State, believes so much in communal life. Every morning you see your brother, hey, what's up, you hug, you shake, you do the normal wudu and stuff like that is common in Anambra State. And these are things the World Health Organization are telling us are the simplest ways of people to contact this virus. So that is why the Public Enlightenment Committee moved swiftly into action. Thank God, the House of Assembly members were co-opted into this as the head of their various constituencies and the local government chairman.
As part of measures to ensure Anambra's preparedness to combat and manage the COVID-19 pandemic, the state trained 21 heads of department at the local government health offices on the protocol for COVID-19. The training was to get the officers prepared ahead of possible identification of any case of the COVID-19 pandemic in the state and on how to remain safe while doing the job.
We trained a lot of medical personnel. WHO came on board to support us in that. NCDC came on board to support us with that. We trained doctors at the level of training of trainers. So they built capacity to become facilitators to train more people. That was done. We trained them in infection prevention and control, and we trained them in case management. So with this level of training cascaded down to the primary health care level, we were a bit confident that if this comes, we're able to deal with the case.
The efforts of the Obiano administration and the COVID-19 Action Committee to ensure that adequate facilities were put in place to contain any eventuality became manifest when it successfully assembled a 240-bed protective care center ready and equipped at the NYSC camp Umuawolo Mbauku, 100-bed protective care center ready and equipped at General Hospital Onitsha, and a 100-bed protective care center at Umeri General Hospital.
The forecast that we made of the case scenario that we have in Anambra, the worst case scenario possible, we set up a protective care center at the brand new NYSC camp at Umuawolo Mbauku, where we'll have 240-bed facility. At General Hospital Onitsha, we have an ultra-modern protective care center there, where we'll have a total of 58 beds. At General Hospital Umeri, the government had put 20, then Access Bank added 100. So at that place, we have about 120 bed spaces for isolation center. At Immaculate Heart Multi-Specialty Hospital Aguleri, we have 10 bed space properly equipped. All of these were in readiness for whatever the worst case scenario could be. For us to know that we have places where our patients will go into and still be very comfortable. All of this will take up our capacity to manage cases. We're not praying that all of those beds should be occupied, but this is us just being prepared.
In a bold move to contain the spread of COVID-19, all markets in Anambra State were shut down, including schools, places of worship, bars, restaurants, and nightclubs. Even social gatherings like weddings and burials were not left out.
Anambra indigenes are very migrant. They are all over the world, and therefore, since there was an emergence of a global pandemic, any present-minded leader will know that if there is an exodus, a rush back home, that Anambra will be a hotspot. Therefore, one of the primary things to do, instinctive things to do, is to lock down. Not wishing anyone who is out there any bad, because this is an illness that follows people. When you frustrate the movement of people in and out, you frustrate the circulation of the ailment.
In furtherance of the detection, prevention, and protection plan of the State COVID-19 Action Committee, the Anambra State government commenced the fumigation of major markets in the state. 63 markets were fumigated as part of measures not only to aid the fight against COVID-19, but also to eradicate disease-spreading germs and rodents from the markets.
Remember when this fumigation happened, we were on lockdown. So the essence of that fumigation then, we had a dual pandemic we were fighting. We were fighting Lassa fever and we were fighting COVID-19. So the idea behind the fumigation then was to make sure that we rid our market of pests so that we decrease incidence of diseases in the marketplaces. So it was a good strategy by government to make sure things work in the market and keep our markets clean and disease-free.
To cushion the effects of the coronavirus pandemic, Governor Obiano announced an economic stimulus package for the Anambra. He approved 10% refund on all personal income taxes paid by business owners and traders in Anambra State in 2019. He approved a 2-month waiver to keke and shuttle bus operators in the state on the usual permits they pay.
What is more, all the employees are also giving 10% rebates. I do not think any state in this country has gone as far as Anambra State has gone to ameliorate the condition of the most vulnerable in society in the wake of the COVID-19 pandemic.
The state government also distributed 200 bags of rice to the elderly and 400 bags of rice to the youth in each of the 181 communities in Anambra State as palliatives to further cushion the effect of the lockdown on Ndi Anambra, especially the needy and the vulnerable.
And it is quite appreciated. His Excellency also asked the honorable members, please, you guys should help me. You are my representatives in your various constituencies. We had a meeting, the honorable members. I said, yes, some of the crunch, we'll have to do something, like follow the footsteps of His Excellency. And I'm quite sure, and I'll tell you that there's no honorable member in the House of Assembly that distributed anything less than 1,000 bags of rice in their constituencies. Some even added Indomie noodles, yam, bags of beans, and other stuff. So I appreciate Ndi Anambra, I appreciate His Excellency, and I believe together, the way we're doing all this with one spirit, we're going to fight this COVID-19.
The clarion call by the Governor of Anambra State, Chief Willie Obiano, for Ndi Anambra to give financial and material support to the Anambra State COVID-19 Fund has received massive support. Their response has been remarkable. Ever since, donations have been pouring in from individuals and corporate bodies who feel that the time to rekindle the people's famous communal spirit has come. So, in what looks like an extended response to Governor Obiano's call, many successful indigents of the state have organized several palliative efforts to assist their kith and kin across the communities.
Our people responded quite generously. We have received more than 100 million naira in such contributions, and the governor had pledged that every bit of this money must be used for this. Some of the medications that have been bought have come out of that account. So that response, and it's still continuing.
While we appreciate people that are giving us 10 million, 1 million, 5 million, we still appreciate those people that gave us 1,000, 2,000, 5,000, and all of them, we all are coming together. This is the time we will show that we are one in Ndi Anambra, and Ndi Anambra has really done it.
This Onyara na 1 year, and we are brothers keeper. A lot of people in various communities, in my own town of Rupu, the wealthy distributed both money and food items, and that's how it's replicated in other communities.
In spite of its preparedness, Anambra State recorded its first COVID-19 index case, which was reported by the Nigeria Center for Disease Control, NCDC, on Friday, April 10, 2020. The index case, who was moved to the Protective Care Center in Onitsha, was successfully treated and discharged.
When the index case came, we responded as already prepared. Our team of healthcare providers took in this case. They were bold and courageous. They managed this case in a very professional way. In 5 days, that index case was turned from positive to negative, and we celebrated that. By the 12th day, we were able to discharge that index case from our facility. And there were lessons learned from that interaction. Since then, we've had multiple more cases, and they have been managed in a very professional way.
Measures are still in place to ensure there is clean living that will not allow the dreaded COVID-19 much further gateway into the state. The new cases that tested positive in Anambra State can be seen to be due to the aggressive testing going on in all the 179 communities of the state.
Yes, indeed, my brother, I can confirm to you that Anambra State has a testing center located in Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amakoka. This machine, as a matter of fact, was gotten into Anambra in the year 2018. And that will tell you the foresighted disposition of His Excellency. And this same lab was designated a mega lab in 2019. So it is this mega laboratory that NCDC are now tracking to expand COVID testing. Yes, this Abbott machine, M200, can do 510 samples per run. However, it must be important to state that most of these testing capabilities can be limited by supply of reagents, which can only come from NCDC. It cannot even be purchased by any state government. It is NCDC that supplies the reagents to states. So these are the essential limiting factors. Because we are indeed the first in the country to begin to test COVID with M200. The only problem is that Ndi Anambra must begin to believe that COVID is real and obey the directives of the COVID team. so that we cannot come out from this. There is no two ways about it. The government has said, put on face mask. We have to obey and put on face mask. It does not kill anybody. It does not debar anybody from doing anything. So that you don't give, and then you reduce what you take. So it's simple. And then report yourself promptly when you have any complaint, because our experience has shown that in managing them, when they come early, before their oxygen desaturation goes down, it is easy to nurse them to good health.
Anambra, of course, has some of the best hands in medicine, which ensured that the index case was treated and discharged with dispatch. The new cases cannot but be handled with this guaranteed expertise.
Unbelief is one of the greatest things that is causing this spread. People don't believe that it's there. And that's why I choose to come out to tell people, if you say COVID-19 really, you are being naive. At this point, as a judge, I want to appeal with our special pharmaceutical industry. They have a role to play in saving people's life. When someone has come, he has bought one brand of anti-malaria, he back again, they give you another one. You have to ask, we have finished one course of anti-malaria, why are you still coming back again? Because it's smelling like malaria typhoid, the same tiredness, the same lack of appetite. A time came, I started consuming this Lucozade boost because lack of energy. You know, the coughing they are talking about is a later stage. But generally, you think we are dealing with malaria typhoid. I want to still appreciate these people because they had accurate diagnosis. They knew what they were dealing with. Even though as a patient, I was not aware, I didn't believe, but they knew exactly that this could be COVID-19. When I came here, they responded in the most professional manner. And it's because of their commitment and level of intervention that saved my life.
For the first time, I don't believe Corona is the real. Really, I just feel the thing like malaria in my system. Then after they start giving me treatment, taking care of me, after 5 days, then come and took my sample again. They say I'm still testing positive. I spent 14 days that place. Then took my sample twice, still testing positive. Before the third one, I can't text negative. And the one surprised me that I know that government is serious about it. The isolation center, since where I visit that place, the service was okay. One. And the secondly, every like 3 hours or 2 hours, a doctor will come and check you or then call us on phone. How do you feel? How do you feel in your system? Are you okay? I will say, doctor, yes, I'm okay. What are you going to eat? So I don't have much thing to say. The only thing I will say, just God bless Chief Willie Obiano'S and the God bless Anambra.
I think I gave my husband the heads up when I lost my sense of taste and smell. Before then, I was having headache and slight fever and I lost appetite. I reported at the hospital. They carried out a test and said it was malaria. They gave me malaria drugs. And when I started the medication, 2 days later, I couldn't smell anything. I was cooking, I can't taste what I'm cooking. I can't smell anything. My husband told me maybe it was the malaria, it was gonna go. And it lingered for like 1 week. I called him and said, please, I'm scared. And I've been hearing that loss of taste and smell is part of the symptoms. Please, what do? We can't, this is lingering for long. So he had to call the emergency care center and told them that we need to do tests. I've been experiencing this. And just immediately started experiencing the same thing too. So we called and we actually went to their office and they carried out the test. COVID-19 is real. It is real. We should stop living in denial. As a woman, it might not be easy because you're just like the pillar of the home. You're dealing with children, your husband, you go to markets. For some of us who work, you deal with people at work too. So the basic thing is ensure you adhere to all those safety precautions. And when you see or notice any symptoms, call the emergency care center so that you can be tested and be sure that you're fine. And even if you're positive, it's not a death sentence.
As the campaign against the coronavirus pandemic in Anambra State has now entered the phase of community searching, the state government has decided to establish a COVID-19 task force in each of the 21 local government areas in the state. The government has also decided to set up a COVID-19 task force in each of the 326 wards in the state. Both task forces are to take to the grassroots the message of the dangers of COVID-19 and how to prevent the spread of the contagion.
It's imperative we do this because we have moved to the second phase of the battle against COVID-19. We call it the phase of community search. These people may not be medical people, but they can play a critical role. So we have the buy-in of the community.
The leader of that team is the counselor. Then you have the woman leader in the community, you have the youth leader in the community, you have the ward development committee chairman, and then somebody from the Ministry of Health. Their job includes sensitization, includes mobilizing people. Their job includes even security in that area. If there are palliatives to be distributed, they will help distribute these palliatives. Their job includes finding people with signs and symptoms of this disease and bringing them very early to the medical system so that they get help.
Governor Obiano'S supportive and humane wife, Dr. Ebelechukwu Obiano Osudieme, continues to imprint the Obiano legacy in the hearts of the Anambra, especially the widows, the less privileged, the destitute, and the physically challenged. Through the Caring Family Enhancement Initiative, CAFE, she provided welfare packages for inmates of some correctional facilities in Anambra State and the less privileged during the lockdown. Mrs. Obiano'S philanthropic gestures were manifest when she handed over 3 modern bungalows built by CAFE to indigent widows in 3 different communities of Anambra State. This is in addition to houses she built and gave to widows in the past. Providing homes for indigent widows is an act of kindness among many that have endeared the Obiano'S to many hearts.
But as we pray, we must also do the needful. This is the time for Nigerians to begin to understand and appreciate what personal hygiene is all about. Hygiene in general. I called you on for us to launch the use of face mask. So because the federal and the state governments have insisted that for you to leave the confines of the home, you must wear face mask to make sure that this thing does not spread in our state. Teach everybody around this ritual of hand washing with soap and running water. At the end of this whole episode, we shall count. None will be missing. In the name of Jesus.
Despite the challenges occasioned by the novel coronavirus and the resultant lockdown of activities at a time when economies are dwindling under the weight of the global pandemic, Obiano has shown remarkable prudence and outstanding commitment to the development of Anambra State and the well-being of the Anambra. The governor traversed from Mmiata Anam, where he inspected the road and bridge undergoing construction, to the massive 100-foot road erosion control project in Nnewi. The ongoing Abatete Oruku Alo bypass also received Governor Obiano'S special attention. His legacy projects, the International Conference Center, are on course to completion.
This is going to be the largest international conference center in the south of Nigeria, and it will be a legacy that will interest all the governors that will come after me, because they will make a lot of money from here, and I'll be here again when they start the roofing to see how they are progressing. Thank you very much.
With the battle to conquer COVID-19 in top gear, attention is now shifting to efforts in ensuring that Anambra is returned to its steady course as a leading economic example in the country.
His Excellency reasoned that before markets can open, he had a meeting with the market leaders. And there it was agreed that the market leaders should form COVID-19 task force in each market who will be trained
to ensure that these protocols will be observed. And that training was done, and then the market opened.
The template we have in Anambra State was what others started emulating. Because we trained a certain task force in all the markets in Anambra State to make sure that they are mentally equipped on what they are supposed to do. And when they started, it was quite commendable. But after some time, we noticed that some started relaxing, and because the number is increasing globally, not just here, we have to call them back, remind them of all of those things, and cross-examine ourselves, the procedure and process so far. The Commissioner for Health was here on ground to educate them more. This is a need for us to change our strategy and improve on what we have on ground and see how we can stop the spread in markets in Anambra State.
Governor Willie Obiano of Anambra State has proved that indeed he's a dynamic governor. He's a responsive governor. He's a pragmatic man of action that in spite of the pandemic, he is still committed to delivering dividends of democracy for Anambra.
The information we receive from different quarters indicate that our people have started lowering their guard on COVID-19 protocols. As you are probably aware, I signed the COVID-19 bill into law. Under this new COVID-19 law, among other things that is contained there, it's an offense to be seen in public without a face mask. The offense attracts a fine of 10,000 naira or some hours of community service. I have no doubt that if we continue to maintain the same level of discipline, we will be giving ourselves enough headroom to overcome this pandemic. We shall continue to push back on this pandemic and reduce its presence in Anambra State. We shall overcome this virus by the grace of God.
This is promising for us that when the pandemic has come and gone, Anambra State will remain as focused as always.
With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make